Hello guys, welcome to our new video. In this video I am going to show how you can use the pulse oximeter in the home. Now this is a pulse oximeter. I am going to open. This is a new pulse oximeter and we have to insert the batteries here by opening this cap. I have two batteries, we have to open and fit in the batteries here. This is the instrument that measures the oxygen saturation of oxygen in our body. There are different instruments like the blood pressure machine that measures the blood pressure of our body, and this is the instrument that measures the saturation of oxygen in our body, number one, and number two, this measures the pulse rate. And today mainly we are going to discuss about the saturation. How much saturation is normal, and in the patient which are infected with the corona, if the saturation is decreased, then when the patient is consult with the doctor, we have to discuss these things. Now before to perform to measure the oxygen concentration or the oxygen saturation by this instrument, first we have this two part here. If you give the pressure, it will open like this. And first, if there is any nail polish or there is any mehndi in your finger, we have to remove that and insert your finger, mainly thumb, index and middle finger. These three fingers are used. And in case of the right-handed person, generally right hand is used, or in case of left-handed person, generally left hand is used, but we can use any hand. Now I am going to show the procedure. Look here carefully. Just on your oximeter and insert your finger. Here the light is red. We can see there is a red light here, and insert this finger by the nail is above, and insert here in the red your finger here. Just wait for a few minutes, few seconds, waits for 10 to 20 seconds. Now the reading comes. There are two readings. One is SpO2, that means the saturation of oxygen. This first one is SpO2. This is saturation of oxygen. It's 99. And it is pulse. Its here is 83, 86, 90. It is fluctuating the pulse. And there are some precautions that we have to take before reading during reading the oxygen concentration. If we give the pressure behind here, there will not be any curve. You can see a curve in down. This will be stopped. You can see a flat here. This after removing the pressure, you can see like this. There is curve is moving up and down. If the curve is flat, then remember that there is a fault in measuring the oxygen concentration. And you have to remove your nail polish. If your hands are extremely cold, then we have to warm up your hand. And this is the procedure how you can measure the saturation of oxygen in the home. And its value is generally above 95 in healthy individuals. Above 95, like 95, 96, 97, 98, 99 also in healthy individuals. And if below than 95, it is called hypoxia. The hypoxia is divided into three types now. Up to 90, it is mild hypoxia. Below 80, below than 95, below than 90 up to 80, it is moderate hypoxia, and below than 80, it is severe hypoxia. And there are different criteria. If the patient is infected with corona or COVID, then the saturation is decreasing. And for this, if the saturation is below 95, you can consult with your doctor. Or if the saturation is decreased, when the patient tell the patient to walk 40 steps, it is the criteria of World Health Organization. Tell a patient to walk 40 steps if the saturation of oxygen is decreased by 3 points. For example, the saturation of oxygen is 93 and it's decreased by 3 value. That means if the saturation come in 90 by walking 40 steps, then you have to consult with your doctor. And it's for today. If you like our video, please subscribe our channel. Thank you.